could you brag on your team for us a little bit? Because there isn't anybody who works at the hospital who doesn't interact with the physician management, with the non-physician management. We're all very impressed by your team, which speaks volumes to you. But explain to us, you know, who your lieutenants and sergeants are, because they truly do a ton of the work. And you've really assembled a group of people that deliver an A+ product to our community. And so tell us a little bit about your team.
Sure. Well, and it really starts with putting what we call the administrative team or the senior team together, but it really is a much broader scope of leaders than just the administrative team. But certainly the individuals that I work with the most throughout the day is, you know, my CFO, Sean Hartley.
That's a Chief Financial Officer.
Chief Financial Officer, the Chief Operating Officer and Chief Nursing Officer, Crystal Hayden, who really is kind of the quarterback of the operations of the day-to-day. Mary Strickland, who is the VP of Nursing, Davis Green, Dorsey Tobias, and Ann Schreiner, who is our Chief Medical Officer.
All sharp.
Just do an incredible job of bringing each other's strengths. Danae Dickens, who is the Executive Director of HR, is part of that team as well. And they all bring together and enhance each other's strengths, help each other when we have challenges, and give insight. And then, of course, we're supported by a whole cast of department directors and executive directors, leaders, both formal and informal in the hospital, who just go above and beyond each day, and the staff that take it upon themselves to make those decisions for their patients and help communicate with the physicians. And of course, to your point about the complication or the complexity of healthcare, you know, it is really three components every day. There's the operations of the hospital, there's the person who has to take the x-ray or draw the blood, transport the patient, deliver food, all those things, and then deliver linen. And then there's the physicians. Some of those are employed by us, some are independent and have their own practice, own business, have their own revenue, and we have to coordinate that care when we don't necessarily have direct authority in that. And then there's the payer, of course, and then the patient. And the payer gets involved with us and makes decisions about the care that we can or that you can order, deliver, and how the manner in which we deliver it. And a lot of times that is not as transparent as it should be. To the patient. Right. The patient really gets impacted by that. And it's really about the discussions that are going on with the payers, the physicians, the staff.
There's a ton of work behind a patient's back, isn't there?
There is a great deal, and it's all being worked, and many days we do it seamless and everything comes out. But certainly there are opportunities for us to have challenges or hiccups throughout that day. And you really have to know where they're going to come, plan for those, be proactive,
and know how to deal with
them.
Right, because collectively the community is served better if you do. But even on an individual basis, somebody's insurance company may not approve a procedure that their doctor told them they absolutely need.
Absolutely.
And the amount of work that goes on behind the background to make sure that they don't have a large bill.
That's right, and to get the documentation to support that operation.